Dr. Garg, I really want to think about the community as a whole, the patient, their family, their caregivers, their physicians, and also stakeholders and public policy. So what is the importance in patients owning their experience and sharing their stories with others, including impacting other patients, researchers, and policy decision makers?
Great question. In our journey of last 10 years, there are certain things which are becoming clearer. So we already talked about acute care, chronic care, self-management, internal, external. The other thing which has become very clear, and as one of our recommendations from this conference, is how do you really make a difference? So what is the gap? So what's emerging is that we emphasize so much about the individual care. We need to add to this what you might call community care. In other words, community is engaged in influencing that particular process. Now, I'm not talking about advocacy. I'm talking about still system development. We like to work in groups. We are not that much of an individual. The motivation is my brother says so, my sister says so, my mother says so, my daughter says so. That energizes us. And I think we need to use that. So community engagement in all these interventions. And there is no place right now which that exists. So I think policymakers, you're asking what impact this has on policy, policymakers should reflect that. And in the past, there were some modalities available where this was happening without people realizing it's happening. So, for example, religious ceremonies, religious activities was bringing people together. And in our industrial world, it's getting less and less. So I think we need to create new ways of thinking and bringing people together. And there is no better way to do that than health. So I would say that is an important piece of community engagement, community participation. The other, I would say, there is influencers. So our work clearly shows there are some people who influence this more than others, and we need to incorporate them in this care. In South Asian community, still family is the biggest influencer. And even in a nuclear South Asian family is still very big influencer. In our community, a woman has such a big influence, mother, sister, wife, daughter. They have such an influence on this behavior. And I think we need to incorporate that in our solutions. We somehow listen to that. Nudging takes place. And the outcomes are much better when that is in play. Certainly the science seems to say that in South Asian community, when intervention is done as a community, it has a bigger impact than when it's done individually.